like, okay.
So this is Anna, also from Omni, and she's also from the Dominican Republic, where they've had a lot of issues surrounding manual lymph drainage because they don't seem to really know what it is and what it isn't. And she is one of our instructors, trainees right now, after many years of practicing MLD. So Anna, you have the floor. Tell them what you want to know and what you've seen in your country, because it's really heartbreaking to see people go through surgery and then go through pain on top of it.
Yes, so I personally, for 5 years that I've been practicing this, I've been trying to educate people, especially people from my country, where they don't have any knowledge of what they're doing, and they are caught up in the new thing that people want results instantly. So they are being very rough to the body in a way that they're actually traumatizing the patient, and many of the times to not only the patient but also their lymphatic system. So I actually want to be the first person to go to the Dominican Republic and be able to educate them about the lymphatic system, how important it is to be very gentle with this system. This system is very superficial to your skin, which means that you need to pump it very gentle for it to, that's all it needs. You just need to be gentle and pump it for it to work. But unfortunately, we have some cases over there where people are just being so rough because, like I said, people want instant results, and I always try to educate them that lymph drainage is actually also instant, but it doesn't work in 5 minutes. It works in 24 hours. So yeah, like I said, I want to be the first person to go there, and I am so passionate about lymph. I try to educate people every day in my practice because I have clients from everywhere. I have clients that have autoimmune conditions. I have clients that have cancer. I have clients that they just want to lose some weight, and a lot of people that want to lose some weight, they have in their mind that they have to suffer, and I try to educate them that you don't have to suffer to actually remove inflammation from your body. So I love lymph drainage, and I will continue to educate people about the subject.
And we're going to pull out something special. She has a special mission and passion for working with infertility,
Yes,
and that's
I
a big
do.
topic coming
Yes,
up
I
this
do.
year.
Yes, that's actually one of the reasons why I'm here, because, well, this is not infertility, but women that get pregnant and have C-section, and then later on in life, they have all these problems that they don't know what it's coming from. They have back pain, they have lower back pain, they have knee pain, they have neck pain, they have all this pain, and they keep doing things, but it's not solving their issues because it's all connected to the C-section. I mean, any scar do that, but that's what I was kind of gravitating towards. And of course, the infertility part of it, which I think it goes hand in hand with each other.
Yeah, you really need that MPS to break down the scar tissue without causing more scar tissue, which a surgery would do, and then allow the lymph to flow and bring in lymphocytes so that that person can get pregnant. And we have seen, and we have infertility clinics using it that way. And I know that's her passion. She wants to go home and she wants to bring this news out for so many infertile couples, and she's already had a few that have gotten pregnant.
I have one person, but we don't know, if it was just coincidence, but we practiced it, and she's been my regular client for many years, and it was, like magic. And so I want to do that. I want to help women get pregnant. I noticed that in this 5 years that I've been working, that I have a lot of IVF clients, and I have one specific client that she's like 27, 28, and she's already done 7 IVF. So like that's kind of also messing with her head, after you go 7 times through something that actually you're not successful at it. So that's when I got interested in the sobadas, which is a Mexican practice for the womb. And 100% of the women that I have met that did it, 100%, they all have gotten pregnant without actually having to do surgery. Because everything's surgery, and then the scar tissue comes. And I have clients that have scar tissue, and then they go for scar tissue removal, and then they get scar tissue again. And then it's like they're in this cycle, and it's so sad to see them go through this. So I just want to bring other solutions where we can gently remove the problem without having to actually make the body go through that traumatic experience of surgery. Because surgery can be traumatized, but I understand that we need it sometimes. But even when we need it, it can be traumatizing for the body.
I really think that there is a strong psychosomatic connection when this goes on. I did have a student, and she tried 10 years to get pregnant, and she came to me crying in the college, and she said, she just broke down, and she says, I've been wanting to get pregnant, and this feeling, I don't know how to explain it. I just felt this feeling come over me, and I said to her, I said, you are going to get pregnant, and you're not going to be able to finish my class. And within the next 6 months, you're going to be gone. You're going to be pregnant. And she started to cry. And I just touched her with my hand, and I touched her womb. She allowed me to. And I said, you listen to me. You're going to get pregnant. Do you know, it was maybe 2 months later, she came back to me, she goes, I'm pregnant. After all these surgeries, after all this scar tissue, she was pregnant. And I said, there is something psychosomatic between our womb and our mind.
It is so important
that we got to address, and we women have to champion that and not back down and just say it's okay. It's not okay.
One of your main areas in your life, and then I learned that your womb drops many times actually throughout your life, the same way that your neck gets in pain, or that you feel like lower back pain, or your muscles move, So I learned that actually throughout your life, 100% of women, their womb drops. If your womb drops, your life is not going to be balanced. So you have to bring the womb back, especially after you have kids. And especially if you went through anything traumatic or any of that. So if your womb is not up, your life is not 100% balanced, because that's our main, for women, that's kind of like our main, area there.
Yeah, it's like our anchor, and
that's what makes you a woman. That's what makes you a woman, So if that's not balanced, your life is not going to be 100% balanced. And then, like we know, you're going to have other side effects that you don't think are connected to that, but everything is connected in your body.
So everybody who wants to talk to Ana, you're right there with Jamie at Omni. So we're going to say that phone number again.
So our number is 239-248-1608. 239-234-1608.
And they'll be bringing on the LRT. And my friends, you know where to call in your area, or even if you need to travel, guys, this is the place. So you're going to hear more today. Instructor Lady is up on her table. We're getting all the people in, and you're going to hear an earful today. So be ready. This is so much fun. I like to be a camera person.